Have you ever started your morning with what you thought was a healthy breakfast, only to feel that burning sensation creeping up your chest before you even finish your coffee? That uncomfortable fire that ruins your entire morning and makes you dread eating anything at all. Or maybe you wake up already feeling that acid in your throat, and you know that one wrong food choice at breakfast will turn your whole day into a painful struggle. If this sounds painfully familiar, you need to understand something crucial. Breakfast is not just the most important meal of the day for energy. For people with heartburn, it is the meal that sets the tone for your entire digestive day. Get it wrong, and you will suffer for hours. Get it right, and you can actually start healing your system from the moment you wake up. I am Dr. Grace Nakamura, a board-certified gastroenterologist with over 12 years of clinical experience, treating thousands of patients with chronic heartburn and gastroesophageal reflux disease. Throughout my career, I have seen countless people make the same devastating breakfast mistakes every single morning, triggering severe acid reflux that could have been completely prevented. Today, I am going to reveal 5 specific breakfast combinations that not only prevent heartburn, but actually soothe your digestive system and promote healing, all backed by solid scientific research and clinical evidence. But I must also warn you about 2 extremely popular breakfast choices that millions eat every morning thinking they are healthy or at least harmless, when in reality they spike your stomach acid production immediately and can cause burning pain that lasts for hours. Before we dive into this critical information that could transform your mornings and your entire day, if this content can help you or someone struggling with heartburn, please leave your like down below. And if you want to receive reliable medical information about digestive health every week, subscribe to the channel and turn on notifications. Your journey to pain-free mornings starts right here, right now. Let me ask you something honest. How many mornings have you ruined by eating the wrong breakfast? How many times have you felt that burning before you even get to work, setting a miserable tone for your entire day? As a gastroenterologist who hears these stories daily in my practice, I understand your frustration deeply. Patients come to me exhausted, having tried different breakfast options based on generic advice, yet their morning heartburn persists or gets worse. That is exactly why I want to give you precise, medically sound guidance today, based on years of treating real patients and seeing real results. The first healing breakfast I recommend is plain oatmeal with sliced banana and a drizzle of honey. This combination is incredibly powerful for heartburn relief and prevention. Oatmeal is a whole grain that is naturally alkaline and helps neutralize stomach acid. It contains soluble fiber that absorbs excess acid and forms a protective coating in your stomach lining. The fiber also promotes healthy digestion and helps prevent the backward flow of stomach contents. Bananas are one of nature's best natural antacids. They contain compounds that stimulate mucus production in your stomach, creating a protective barrier against acid. Bananas are also rich in potassium, which helps neutralize acid and reduce inflammation. The honey adds natural sweetness without triggering acid production like refined sugar does. Raw honey has anti-inflammatory properties and can help soothe irritated esophageal tissue. To prepare this therapeutic breakfast, cook half a cup of plain oatmeal in water, not milk, because dairy can trigger heartburn in many people. Top with 1 sliced ripe banana and 1 teaspoon of raw honey. Eat this slowly and mindfully, chewing thoroughly. Many of my patients report that this breakfast not only prevents their usual morning heartburn, but actually makes them feel soothed and comfortable all morning long. What makes this combination particularly effective is the synergy between ingredients. The oatmeal absorbs acid and provides sustained energy without blood sugar spikes. The banana creates a protective coating and neutralizes acid. The honey soothes inflammation. I have had patients who suffered morning heartburn daily for years, find complete relief within the first week of making this their regular breakfast. One important note from my clinical experience is to avoid instant oatmeal packets that often contain added sugars and artificial flavors. Use plain rolled oats or steel-cut oats for maximum therapeutic benefit. The second healing breakfast is scrambled eggs with steamed spinach and whole grain toast. This might surprise you because many people have heard that eggs cause heartburn, but the truth is more nuanced. Plain scrambled eggs cooked with minimal oil or butter are actually well tolerated by most people with heartburn when prepared correctly. Eggs provide high-quality protein that is easily digestible and helps maintain stable blood sugar levels throughout the morning, preventing the hunger-induced acid production that causes mid-morning heartburn. The key is preparation. Use olive oil or a small amount of butter, not excessive grease. Spinach is alkaline and rich in nutrients that support digestive health, including magnesium, which helps relax digestive muscles without relaxing the esophageal sphincter dangerously. Spinach also contains compounds that reduce inflammation. The whole grain toast provides complex carbohydrates and fiber that support steady digestion. To prepare this breakfast, scramble 2 eggs gently in a teaspoon of olive oil. Steam 1 cup of fresh spinach until just wilted and serve alongside. Add 1 slice of whole grain toast, lightly toasted. Avoid butter on the toast if you are sensitive to dairy. In my practice, this breakfast works exceptionally well for patients who need substantial protein in the morning to feel satisfied, but have been avoiding eggs due to heartburn fears. The combination provides satiety, stable energy, and digestive comfort. Some patients notice that their mid-morning acid spikes disappear completely when they switch to this breakfast. I had a patient, a busy attorney who used to experience terrible heartburn by 10 in the morning no matter what she ate, switched to this breakfast routine. Within 3 weeks, her morning symptoms reduced by approximately 80%, and she could focus on her work without constant discomfort. The third therapeutic breakfast is Greek yogurt with papaya and ground flaxseed. This combination addresses heartburn through multiple mechanisms. Plain Greek yogurt contains probiotics, beneficial bacteria that help balance your gut microbiome and reduce overall digestive inflammation. The protein in Greek yogurt is easily digestible and provides lasting satiety. Papaya contains the enzyme papain, which helps break down proteins efficiently. When protein digestion improves, fermentation in your stomach decreases, and consequently, acid production normalizes. Papaya also has natural anti-inflammatory properties that soothe irritated digestive tissues. Ground flaxseed provides omega-3 fatty acids that reduce inflammation and soluble fiber that helps absorb excess stomach acid. To prepare this healing breakfast, place 3/4 of a cup of plain unsweetened Greek yogurt in a bowl. Top with 1 cup of fresh ripe papaya, cut into cubes, and 1 tablespoon of freshly ground flaxseed. You can add a small drizzle of honey if needed for sweetness. The key is using plain yogurt without added sugars or fruit flavors, as these additives can trigger acid production. Clinical observations show this breakfast works remarkably well for people who experience heartburn, specifically after heavier protein meals. The papain enzyme essentially assists your digestive system, reducing workload and acid production. Multiple patients have told me this breakfast allows them to start their day feeling light and comfortable, instead of heavy and acidic. The probiotic benefits build over time, so consistent consumption for at least 3 to 4 weeks yields the best results. One patient described this breakfast as feeling like a soothing balm for her stomach every morning. The fourth beneficial breakfast is a smoothie made with almond milk, banana, cucumber, and ginger. Smoothies can be tricky for heartburn sufferers because many common smoothie ingredients are problematic, but this specific combination is therapeutic. Almond milk is alkaline and gentle on the digestive system, unlike dairy milk, which can trigger reflux. Banana provides natural sweetness and antacid properties. Cucumber is extremely alkaline and hydrating, helping dilute stomach acid. Ginger contains gingerols that reduce inflammation, speed up gastric emptying, and help tighten the lower esophageal sphincter. To prepare this healing smoothie, blend 1 cup of unsweetened almond milk, 1 ripe banana, half a cucumber peeled and chopped, and 1 teaspoon of fresh grated ginger. Blend until completely smooth. Drink this slowly, not quickly gulping it down, because drinking too fast can introduce air and cause bloating, which increases reflux risk. This smoothie is particularly good for people who prefer liquid breakfasts or have difficulty eating solid food first thing in the morning due to nausea or acid sensitivity. I have observed that patients who have this smoothie regularly experience better overall digestive comfort throughout the morning. The liquid form is easy to digest. The ingredients are all alkaline or anti-inflammatory, and it provides adequate nutrition without overwhelming your stomach. One important note is to avoid adding citrus fruits, berries, or protein powders to this smoothie, as these additions can trigger heartburn. Keep it simple with these 4 healing ingredients. The 5th and final healing breakfast is avocado toast on whole grain bread with a poached egg. Avocado is an incredible food for heartburn sufferers. It contains healthy monounsaturated fats that coat the esophageal lining, creating a protective barrier against acid damage. Avocado is also alkaline and rich in fiber that supports healthy digestion. The creamy texture is naturally soothing to the digestive tract. Whole grain bread provides complex carbohydrates and fiber without the blood sugar spikes of white bread. A poached egg adds easily digestible protein. To prepare this breakfast, lightly toast 1 slice of whole grain bread. Mash half a ripe avocado and spread it generously on the toast. Top with 1 poached egg. You can add a tiny pinch of salt if desired, but avoid adding pepper, hot sauce, or other spices that can trigger reflux. This breakfast provides substantial nutrition, lasting satiety, and digestive comfort. Many of my patients who love traditional breakfast foods but struggle with heartburn find this to be a satisfying alternative that does not cause pain. The healthy fats from avocado combined with protein from the egg and fiber from whole grain bread create a balanced meal that keeps blood sugar stable and prevents the mid-morning hunger and acid production that plague many heartburn sufferers. I have seen patients transform their mornings by switching from their usual problematic breakfasts to this simple but powerful combination. Now comes the absolutely critical warning that could save you from hours of suffering every single morning. I need to tell you about 2 breakfast choices that are incredibly popular, eaten by millions every day, considered normal or even healthy by most people, but spike stomach acid production immediately and trigger severe heartburn within minutes. The first breakfast you must completely avoid if you suffer from heartburn is orange juice and any citrus juice with your breakfast. I know this is devastating news because orange juice is synonymous with breakfast in many cultures. It is marketed as healthy, packed with vitamin C, and refreshing. However, for heartburn sufferers, orange juice is absolutely one of the worst things you can consume, especially on an empty stomach first thing in the morning. Orange juice is extremely acidic with a pH around 3.5. This high acidity directly irritates your esophageal lining and stimulates massive production of stomach acid. The citric acid in orange juice is known to relax the lower esophageal sphincter, the crucial valve that should stay closed to prevent acid reflux. When you drink orange juice, you are essentially forcing this valve open while simultaneously flooding your system with acid and triggering your stomach to produce even more acid. The effect is almost immediate. Many patients tell me they feel burning within 5 to 10 minutes of drinking orange juice. Even worse, the acid spike can last for hours, ruining not just your breakfast, but your entire morning and early afternoon. This applies to all citrus juices, including grapefruit juice, lemon water, and even seemingly healthier options, like fresh squeezed juice. The acidity is the problem, not whether it is fresh or processed. In my practice, I cannot tell you how many patients have come to me suffering terrible morning heartburn, and when I ask about their breakfast routine, they mention drinking a glass of orange juice every morning thinking it is healthy. The moment we eliminate all citrus juice from their morning routine, their symptoms improve dramatically, often within just 2 or 3 days. If you currently drink orange juice at breakfast and suffer from heartburn, eliminating it completely is one of the single most important changes you can make. Replace it with almond milk, herbal tea, or plain water. Your esophagus will thank you. One of my patients had drunk orange juice every morning for 30 years and suffered daily heartburn that entire time. She never made the connection. When she stopped the orange juice, her morning heartburn disappeared within 1 week. She was shocked that something so simple made such a profound difference. The second breakfast that spikes heartburn immediately is coffee with pastries or donuts. This combination is a perfect storm for acid reflux. Let me explain why each component is problematic and why together they create devastating effects. Coffee is naturally acidic and contains caffeine, which stimulates increased production of stomach acid. Caffeine also relaxes the lower esophageal sphincter, allowing acid to flow backward more easily. Even decaf coffee can be problematic because coffee contains compounds beyond caffeine that trigger acid production. Pastries and donuts are made with refined white flour and loaded with sugar and unhealthy fats. The refined carbohydrates cause rapid blood sugar spikes, followed by crashes, which triggers hunger and more acid production. The high sugar content feeds harmful bacteria in your gut, causing fermentation and gas that increases abdominal pressure and forces acid upward. The unhealthy fats in pastries slow down digestion significantly, keeping food in your stomach longer and giving acid more time to reflux into your esophagus. When you combine coffee with pastries, you get multiple simultaneous triggers. The coffee increases acid production and relaxes the sphincter. The pastry causes blood sugar chaos, fermentation gas, and slow digestion. The result is often severe heartburn that can last for hours. Many people experience this but never make the connection because this breakfast is so normalized in our culture. In my practice, I have worked with countless professionals who grab coffee and a muffin or donut on their way to work every morning, then suffer terrible heartburn by mid-morning without understanding why. When we eliminate this combination and replace it with one of the 5 healing breakfasts I discussed, the transformation is remarkable. One patient, a teacher who had this exact breakfast daily for years and took antacids every morning by 9 o'clock, switched to oatmeal with banana. Within 2 weeks, she had not needed a single antacid in the morning. She described feeling like a completely different person, able to focus on teaching instead of constantly managing heartburn pain. I want to address a crucial question. Can you still have coffee if you switch to a better breakfast? The answer depends on your individual sensitivity. Some people can tolerate small amounts of coffee, preferably with food and with added almond milk, to reduce acidity. However, many heartburn sufferers find that eliminating coffee completely, at least temporarily, allows their system to heal. You can try herbal teas like chamomile or ginger tea as alternatives that actually help heartburn instead of causing it. Another common question is how quickly you will see results from these breakfast changes. Most patients notice significant improvement within the first 3 to 5 days of switching to healing breakfasts and eliminating trigger foods. Maximum benefits typically occur after 2 to 3 weeks of consistent changes. The key is consistency. Having one good breakfast while continuing to drink orange juice or coffee with pastries most mornings will not produce lasting results. These breakfasts work best as part of a comprehensive heartburn management approach. This includes eating smaller portions, avoiding eating within 3 hours of bedtime, elevating the head of your bed, maintaining a healthy weight, and managing stress. Patients who adopt this holistic approach experience the most dramatic and lasting relief from their symptoms. As a gastroenterologist dedicated to helping people overcome digestive disorders, I want you to understand that your breakfast choices have enormous power over your entire day. You do not have to accept morning heartburn as normal or spend hours suffering because you ate the wrong thing. Evidence-based nutritional choices really work when properly implemented. I see patients every day who suffer unnecessarily because they lack reliable information about which breakfast foods help and which ones harm. That is why I created this channel, to share scientifically validated knowledge and practical strategies from real clinical practice. Every week I provide tested protocols and guidance based on treating actual patients with real results. If you want continued access to trustworthy gastroenterology information, subscribe to the channel and activate notifications. Let us work together to transform your mornings and your digestive health. Remember, heartburn does not have to ruin your mornings or your days. With correct information, smart breakfast choices, and consistent application, you can wake up feeling comfortable and start every day without pain. Begin tomorrow morning with one of these 5 healing breakfasts. Completely eliminate those 2 trigger combinations and give your body the gentle, nourishing start it desperately needs to heal from within.